Welcome, everyone. Good evening. This is the first webinar of the 2023 H&D series, brought to you by Justin Ettinger, Director of Vestibular Rehab at H&D Physical Therapy at our Midtown office, and Oliwia Juszcyk from our 88th Street and Midtown office, also certified vestibular therapist. And we're so thrilled to have you guys here with us again. It's a pleasure to see everyone returning from their vacation and in anticipation of the weather that is about to come. We've decided to bring to you ways in which you can improve your balance and your coordination in the slippery weather. So, just a couple words real quick. We're going to do a little bit of a presentation in advance, and we're going to show you guys some slides. Then we're going to maybe break for a couple questions, and then we're going to do some demonstrations on how to improve your balance and coordination and strength. And then we're going to maybe break at the end for an open forum. So please, if you have any questions, just type them in the chat and we'll get to it throughout the presentation. And don't worry, it's all being recorded and you'll be able to access this a couple of days later as we edit it and send it out. So without further ado, Justin, do you want to take it away?
Again, I'm Justin Ettinger. I'm a physical therapist. I'm the Director of Vestibular Rehabilitation at H&D Physical Therapy. I'll be presenting today with Oliwia, and we'll be talking, what Aaron said, about balance, fall risk, and safety when walking in the wintry weather. So today we are going to talk first about some fall risk facts. We're going to try to give some tips for if you have to go outside and walk in the winter weather. We're going to try to give some tips for that, and we'll also have an active demonstration of some balance exercises, which we'll invite you all to participate with. And then we'll end with some discussion and some question and answers. And then we have Oliwia.
All right. Hi, everyone. Thanks for being here. My name is Oliwia. I'm the vestibular therapist here at H&D Physical Therapy at our Upper East Side location. Yeah, let's get started. So first, we want to draw attention to why is it important to talk about falls. So while 1 in 5 falls cause a serious injury, like a broken bone or a head injury, more than 95% of hip fractures are caused by falling, and about 75% of those are actually women. Women are much more likely to break a hip when they suffer a fall. Falls are the most common cause of traumatic brain injury. And studies have shown a high correlation between cold weather and an increase in falls amongst older adults. So kind of draws attention to why we want to talk about this today. So what can you do to prevent falls since they are dangerous? We go in depth about fall risk and fall prevention in our webinar from September. If you're interested in hearing that, you can reach out to us. We'll have information at the end. But today we're specifically going to talk about winter weather and falls. So the number one thing you want to think about is staying active during the winter months. And that can be hard for anyone. You know, you don't want to go outside, and it's hard to stay motivated when it's dark all the time. But here are some ways that you can stay motivated and stay active. There's a ton of things at home that you can use to exercise, such as soup cans and water bottles can be used as weights. Using a sturdy chair to practice sitting and standing. You can walk up and down your hallway, and there's different variations of doing that. And if you feel safe and you have someone to accompany you, you can always practice stairs with a railing. The best way to stay on track is to follow a schedule or a routine. I recommend setting a daily reminder maybe to just get up and move for a little bit. And if you don't know what to do, you can schedule a visit with your doctor or with your physical therapist. They could always recommend ideas and what's appropriate for you for your daily movement or daily exercise. There's a ton of in-person and virtual exercise classes that you can participate in. We do a balance class every Friday. It's free, it's online. Fridays at 1:30. And then another good idea is using YouTube as a resource and looking up things that are arthritis friendly. I found a lot of great resources on there. But again, if you're gonna start a new exercise, I recommend talking to your physical therapist or your doctor, seeing if it's appropriate for you. And there's a lot of indoor community pools and tracks that can be used for walking around in the winter time. If you're local to the Upper East Side, I know that the 92nd Street Y has a pool, and Asphalt Green, which is also in the Upper East Side, has a track and a pool. We can move on to kind of talking now what happens when you do have to go outside during the winter. It's a little bit different than when you're preparing for a walk in the summertime. So first off is, what can you do before you even think about going outside? What things can you do to prepare? One of the things you should do is check the weather. Know what you're getting yourself into out there. If it's blizzarding or if it's just flurrying, it's going to make a difference how you prepare for it. If you feel unsafe, whether it's the weather or whether it's feeling tired or anything else, try to stay home. If you feel like you need to go outside, it's a good idea to have someone come with you. Always bring a cell phone just in case of any emergency. And you want to dress appropriately. So coat, boots, gloves, hat, all of these things not only are going to keep you from, getting cold, but are also going to protect you in case you do fall, give you a little bit of extra padding. And then you want to winterize your shoes and walking aid. So your shoes should have a thick rubbery sole, something that will grip to the ground. And you can purchase an ice gripper cane tip. Sometimes it's a special cane you can order, or you can just order the attachment for it. And again, will be available for questions if you're interested in that as well. So now let's talk about what happens once you're out there. Normally, if you've ever been to physical therapy, we would heavily dissuade you from shuffling or taking small, wide steps. The only exception is if you're walking on an icy sidewalk. So I like to say you should walk as a penguin would. So what that means is you're going to walk very slowly and carefully. Assume that anything is slippery, not worth it to just take a chance. You want to lean forward just a little bit, keep your feet wide, and take short, small steps. Again, probably something a physical therapist would never tell you to do otherwise, but on ice, it's the safest way to go. Keep your hands out of your pockets just in case you need them for a little added stability or, gives you just a little bit more base. And another idea that I saw is carrying kitty litter. So maybe keeping a little Ziploc of kitty litter. If you see an icy area, sprinkling a little bit of that on the ground will actually give you a little added traction. So you're less likely to slip on the ice. And no, it will not melt the ice. It will only add a little bit of traction under your feet. And unfortunately, accidents do happen. So even if you do take all of these precautions and do your best, there's still a risk for falling. So it's important to learn how to fall safely. So we'll talk through it a little bit of what that means. So number one most important thing, if you don't remember anything else in that moment, is to just try to stay loose. You want to keep everything just lightly bent, wrists bent, elbows bent. And I'm going to demonstrate. You want to bring your elbows up and hands around your ears. That way you're cushioning your head in case you fall. And you want to avoid bringing your hands out in front of you or falling on your knees because this is going to be rigid and you're going to risk fracturing your wrist, arm, or knee. You want to try to land on something cushiony, like your muscles rather than bones. And all of that is difficult to remember in the moment. I do recommend that if you feel you are at risk for falling, if you're worried about your balance, this is another thing that you can talk to your physical therapist about, practicing how to fall safely so you're more prepared in that moment. And then if you do fall, try not to get up quickly. You should rest for a moment and just see how you feel. Does anything hurt? Do I know where I am? Before you go ahead and pop back up. You should ask for help, but just be cautious and make sure that you always see a doctor if you suffered a fall, because even though you might not know it right away, it's good to just get checked out and rule out any other injuries that might have occurred.
It's me now. All right, thank you, Oliwia. Very helpful. So what else can we do about our reducing our risk for falls on the snow and ice? We have one of the biggest things that we can do is exercise. There's a lot of evidence that proves that exercise is extremely beneficial at reducing risk for falls. There was a recent study that was used to advise the World Health Organization about exercise and fall risk from 2020. So as an update to systematic review, they reviewed tons of different studies and lots of interesting results, which I'll just quickly share. So overall, in all these studies, they kind of tallied them all together and noticed that exercise seems to reduce the risk of falls by 23%, which is a lot. It seems like 23 is not so much. It's a lot. Imagine one out of 4 falls could be reduced by exercise, right? But that said, not all exercise is the same, right? So they found that balance and functional exercises reduce the risk of falls by 24%. Multi-component exercises, meaning exercise programs that might include different areas like balance, functional activities, and strength training, reduce the fall risk even more to 28%. And then just doing Tai Chi exercise, which has long been proven to have a really good results with reducing falls, has been proven to be 23% effective. So Tai Chi, Qigong, amazing adjuncts to your exercise programs for balance and falls. That said, the effects of programs that just primarily involving resistance training, like strength training, or just doing dance for exercise, or just walking, which they're all great exercises on their own, there's lack of evidence right now that's showing that that alone would help reduce your risk for falls. So the research is showing you want to kind of do balance and not just one thing, balance, strength, multi-component things, not just walking. Walking's great for you. It's probably not going to be the only thing that's going to be able to reduce your risk for falls. And then lastly, dosage, right? The dosage of your exercises is important, meaning how much exercise should I do, right? And they found that there was a 42% reduction in risk for falls with exercise programs that had included 3 or more hours per week that included balance and functional exercises. That's a huge amount. That's 42% is a very big number. So 3 or more hours per week sounds like a lot, but that comes to 26 minutes a day if you're doing it every day, right? So that seems manageable to me. It doesn't have to be all at once. That's the other thing. Like you totally could break it up, 10 minutes here, 10 minutes there, 10 minutes another time. But yeah, so there needs to be enough exercise, enough repetition for us to make our changes in our brains. So that said, we're going to go right into some exercise. Actually, before that, here are our references, because I'm sure you all are curious, and to prove we didn't make everything up, this is where you can look. You can check it later. All right, so I'm going to stop the share, and I invite you all to move around with me with this. So the this is obviously a class with this 36 attendees, so I know not every exercise is going to be appropriate for everyone. So if it doesn't seem appropriate, don't do it. I'm going to try to show ways how to modify it, the different exercises. And this is being recorded. So at some point, if you feel like you miss it and you want to go back to it, you can review the recording at your own leisure. So the only piece of equipment we need today is a chair. So a chair a nice sturdy chair. We can use the back of the chair for our balance if we need it, right? I always recommend balance exercises. Bare feet, you can feel the ground more. Your muscles of your feet have to work a little harder, but I know that bare feet doesn't work for everyone, and that's totally fine. It's recommended if you're not barefoot to have supportive footwear on. Sneakers, shoes, try not to be wearing socks, sandals, slippers, anything that you could slip with. The area around you, hopefully you want to make clear if you're participating. And if it hurts, don't do it. That's another thing. All right, so that's my spiel. We're gonna start. Actually, Olivia, I'm gonna spotlight you too. So in case we need multiple angles, Olivia will be helping. But we're gonna start. If you're following along, you want to be behind your chair and next to your chair. I'm just gonna move it so it's out of the way so you can see my feet. Right. So we're gonna start standing with our feet together. Right. Arms at our sides. We're gonna look straight ahead. Just trying to get a sense of our balance right now. And then if it feels like a good idea, we try closing our eyes here. Oh, so if you're closing your eyes, feeling too unsteady, just open your eyes when you need to. And we're just gonna notice the difference between your eyes open and eyes closed. We're gonna aim for like 20 more seconds here. Open them when you need to, touch the chair when you need to. Our vision, it's a big sense for our balance. So when we take that away, our brains have to work just a bit harder to keep steady. It can be a good exercise. Couple more seconds, and we'll open our eyes. All right. So we're gonna do the same thing one more time. we're gonna cross feet together again. We're gonna cross our arms. If you feel like it's a good idea. Right, so you can follow Olivia's arms crossed. And then if it feels like a good idea, let's close your eyes, or you can keep the hand close. And just notice the difference with your arms crossed from at your side. Usually arms crossed is a little more challenging, usually. Again, you can open your eyes when you need to. A little sway is normal. And we'll open our eyes, moving your arms at our side, and let's separate our feet. All right, I'm just going to kind of flow right through an exercise routine. So feel free to stop whenever you need to. There'll be definitely time for questions after. So feet are apart. We're near the chair. We're going to go into an exercise I like to call the shift and lift. Right, so we're going to work on shifting over to one leg and picking up the other leg. And we'll put the foot back down, get back to the middle. So I'm shifting to my left and picking up my right, and then carefully putting it back down. So there's a moment where I am standing onto one leg, right? So the slower you do this, right, the more of a challenge it's going to be. Right, so your upper body should be nice and tall. Your core is activating. One more. There I am. Okay. And then we're going to pause there. We'll do the same thing on the other side. Right? So we'll shift. I'm shifting to my right now and picking up my left. and slowly back down. Just, if this is too slow, you can go a little faster, right? If you need to touch the chair a little bit, by all means, it looks easier than it is. Right? It really forces you to have to stand on one leg and control the shifting over. We're going to go a couple more like this. And we'll pause there, and we're going to same thing, we're just alternating now, right? So I'm going to shift to my left, pick up my left or my right, and then right away shifting onto my right and picking up my left. Just alternating, keeping my upper body nice and tall. And this motion is what our hips and our pelvis do typically when we're walking. All right, so I find this a good functional exercise, right? One of the categories of the exercises for the research with reducing falls was functional exercises. Right, when we shift our hips and we walk, it allows us to take a big step with the other leg, right? So if you notice, maybe you're not taking big steps, so you're catching your feet. It could be when you're walking, it could be one of the reasons could be that your balance on one leg is a little off, right? So this kind of exercise could be helpful with that. All right, so enough of that. We'll plant the feet, and we're going to switch gears a little bit. So we'll bring our feet back together, right? I'm going to turn so you can see a little differently. So feet together. We're going to slide one foot a little forward. So I'm bringing my right foot a little forward. The further you bring the foot forward, the more of a challenge it is. So the most challenging would be bringing it all the way in front in a straight line, like a tightrope position. And then to make it easier, you can bring the top foot back a little bit, right? So we're going to try to find a position that's a little wobbly, right? So I'm going to put my right foot almost to the big toe of my other foot. But everyone can be different, right? And just standing nice and tall. We'll look straight ahead and just notice, how much pressure you're putting on one leg as opposed to the other leg, and try to get somewhere in the middle, so even pressure between both legs. And the next thing we're going to do is start to look around a little bit. So if you feel like you need to change your feet to make your foot position a little less challenging, you can bring your foot back, or you can keep it as it is. And then we're going to start to turn our heads to the right, and then back to the left. We'll go a few times right and left, trying to keep our balance. And notice as you're turning your head, just what that does for your balance. It's not unusual for you to feel a little more unsteady when you turn your head. All right, let's go one more right, one more left, and we'll look straight ahead. All right, and let's keep your feet there. We'll try the same thing, looking up and looking down. All right, so let's look up to the ceiling, down to the floor. We'll go a few times like that, up and down, trying to keep the balance. Anytime you need to take a step or touch the chair, by all means. One more up, one more down, and then look straight ahead. Get your balance. Your feet, you might be feeling a little bit. The back leg tends to do a lot of work. Feel free to take a rest when you need. But let's slide your front foot a little back, right? So it's not as far forward. The chair should be right near you. You can touch it the whole time, but I invite you to try to close your eyes if you feel like it's a good idea. If you don't feel like it's a good idea, don't do it. All right, so we'll try closing our eyes, maybe 10 seconds. Wobbles are part of the territory. And we'll open our eyes. Let's separate our feet, right? And feel free to shake it out a bit. Rest if you need, but I'm going to go right into the other foot. can't be lopsided. So I'm going to bring the feet together. We'll slide the other foot a little forward. Whatever foot you didn't do yet. So the further you go forward, the more of a challenge. And the further back you go, the easier it is. And now that you know what the drill is, feel free to kind of choose your own adventure. Right, so we're going to look straight ahead. And let's try turning our head. So let's look to the right and to the left, and then right, and left, one more right, one more left, and then straight ahead. And recover your balance. I should say that if your neck hurts with this, don't turn your head as far. And next we'll try looking up and down. We'll look up to the ceiling, down to the floor, a couple more, one up to the ceiling, down to the floor, and then one more up, one more down. Let's look straight ahead and start to slide that top foot maybe a little bit back, because we're going to prepare to try to close our eyes if you feel like it's a good idea. All right, so let's try closing your eyes if you're following along. Open them when you need to. Couple more seconds. And we'll open our eyes. Let's separate our feet. I'm going to take a water break a second. And then, all right, moving right along. So we were talking about functional exercises, how they're helpful, not only just balance, right? So a combination of functional exercises and balance exercises seems to be the most effective at helping reducing falls and fall risk. So a good example of a functional exercise is a sit to stand exercise, right? It's great for your balance, but it's also very functional. We do it all the time and helps strengthen the muscles of the legs that really help with balance and walking. So we're going to get in a chair. Hopefully a chair that doesn't have wheels. So if it has wheels, don't do it. A nice sturdy chair. So if you feel like this would not be a good idea in the chair that you're in, please don't do it. But what we're going to do, we're going to come sit to the edge of the chair, right? You're going to kind of slide to the edge of the chair as your feet are on the floor, right? And the goal here is to try to do this without holding on. If you need to hold on, push off from your chair, push off from your thighs, whatever you need to do, right? But I'm going to demonstrate not holding on, right? So if you're not holding on, you can bring your arms at your side, you can bring your arms forward, or you can cross your arms. Whatever you like. I find bringing it forward helps counterbalance it. But maybe the more of a challenging one could be to cross it. All right, so whatever version you're doing, if you're touching or not, we're going to try to lean forward and stand up tall. Right? Same thing on the way down. We're going to lean forward, control the descent, try not to let gravity take you down too fast. Same thing. It's this lean forward, stand up tall, lean forward, control the descent. Right? I'm going to go a few more of these before we change it up. Right? Obviously, well, maybe not obviously, the lower the chair, the harder it's going to be. Right? So if you have trouble in lower chairs, you can try it in something higher. Depending on the size of your bed, that's sometimes going to be a good choice. All right, and we'll pause. We'll stop here a second. If that version was challenging enough already, you can keep with that, but I'll show you a way to make it more interesting. All right, so one thing we can do is stagger our feet a little bit. So I'm going to bring my left foot a little forward and my right foot a little back, right? And that's going to put a little more pressure onto one leg as opposed to the other and cause a little balance problem. So again, you can use push off from the chair, or you can not use your hands, but we'll try a few like this, right? Again, you're going to lean forward and stand up and lean forward and sit down. You'll probably notice a little more challenging. The further you bring the foot forward or back, it's going to make it even more challenging. Let's go one more like that. And we can't just build up one leg and not the other. So we're going to switch legs. One leg forward, other leg back. I'm going to cross my arms. That's what I'm doing to be consistent. And again, I'm going to lean forward and stand up. Lean forward, control the landing. We'll go a couple more like that. One more. All right. Enough of that. Let's take a quick break before I take you to the last balance pose for today. Just gonna move things around. So we're kind of going through a lot kind of quickly. So don't worry if you're feeling like you're not going to remember it all. Again, it's going to be recorded. And we do a lot of these variations of these kind of exercises in our weekly free balance class on Zoom. So everyone's invited. You know, there's a small bunch, so it's kind of it's nice quaint class. So if you feel like you need to an adaptation or something's not right, then we're usually able to kind of help out, especially if we can see you. All right, we're going to come standing again next to our chairs, and we're going to do the tree, our favorite exercise. So I will demonstrate the bottom half of the tree, and Oliwia will be the top half. I'll be the roots, Oliwia will be the branches. So, or the trunk, I'll be the trunk. That's better. So we're going to stand, actually touching our chair to get into position, right? So we have a few options with where we can put our feet. So one option is just to pick up just be resting onto your toe. So this is my left leg. So I'm going to say my left, right? So I'm coming up onto my left toes. Let me turn so you can see what I'm doing. That's one option, right? That's the easier option. A little more challenging would be to turn the foot to rest on the lower leg. My toes are still on the floor. The most challenging option that I'm going to demonstrate today is going to be sliding your foot onto your lower leg, right? So either the toes are down on the floor like this, or they're rotated like this, or they're slid up, right? So it's going to be either way you do it, you're going to get some good work. So I'm going to demonstrate it in the middle position like this, right? So you're going to be right now. You're going to be strong through that standing foot. So my right foot is grounded onto the floor, right? Imagine that there's roots growing through my trunk down to the ground, right? You're going to stand nice and tall, right? That core should be nice and strong. And let's take your hand off the chair if you feel like you can, and we'll try to bring your hands to heart center, or one hand. You always can do one hand, or keep coming back to it, right? And we're just going to look straight ahead, standing nice and tall, grounded through that foot, right? And then if it feels like a good idea, we'll try to bring both arms up. Why am I screen sharing? Hold on 1 second. Keep going. There we go. Fixed it. All right, arms down now. Sorry. You've been balancing a while, so hands back to heart center. And then we'll bring your hands at our side, and we'll bring the foot back down. Sorry, technical glitch. So you were balancing for longer than expected. All right, we're going to try that again to the other side. So holding on to the chair, right? We're going to bring the other foot. Those three positions could be coming up onto your toes, resting the heel onto the side of the lower leg, or sliding the foot up a little bit so your toes aren't touching the floor at all. Again, I'm going to demonstrate. I'll demonstrate this time the difficult version. Why not? All right. So I'm standing. I'm grounding through my left foot, and then see if I can let go of the chair. If you can't, that's okay. Just keep touching with one finger, two fingers, whatever you need to do. So see if you can bring your hands to heart center, or one hand. Nice. And then we'll try to bring both hands up, or bring the branches of your tree up. Right? Or one branch, whatever works. It's not easy. And then we'll bring your hands back to heart center, arms at your side, and let's release that leg. All right, so enough of that. Let's come back to sitting. I'm gonna walk down with this part of the part. Right? So let me. All right, so I'm going to sit at the edge of the chair, right? We're just going to do a seated kind of trunk stretch or a tilt, where hands on your thighs, sitting nice and tall. We're going to start to slide the hands forward, and maybe start to slouch a little bit and bring your head down. Permission to slouch. And then we'll slide the hands back, come back to midline. We sit nice and tall, or maybe squeeze, start to slide the hands back even more. Squeeze the shoulder blades back. Maybe look up if that feels like a good idea. Just to stretch the front of the chest. And we'll come back to the center one more time, forward, start to slouch, maybe look down. And then we'll slide the hands back, sit nice and tall. Bring the hands back even, slide it back, shoulder blades back together, maybe look up at the ceiling. And then back to the center. Let's get to the edge of the chair. Find the best positions here. We're gonna get to the edge of the chair, one leg out straight, other one bent. Let's put our hands on our bent knees, sit nice and tall. And we're going to try to hinge forward at the hips. If you already feel a stretch before you hinge forward at the hips, just keep it there. So as I'm just trying to get a nice stretch in the back of the leg. Right, hold it, make sure you're breathing. If it's painful, back off. Right, we'll sit back up. Let's switch legs. Hands on my bent knee, other leg is straight. I'm sitting up nice and tall, shoulders are back, and hinging forward as I'm trying not to round the shoulders and slouch. So no slouching this time. Trying to aiming for a stretch in the back of the straight leg. That's the goal. Might not be working for everyone. And then we'll sit back up. I'm gonna switch my view. You can either stay at the edge of the chair with your feet, if that feels like it's good. Unless if your back's getting a little tired, you can kind of scoot back if you like. But either way, it would be good to have your feet on the floor. So I'm short, so my feet don't touch the floor. I'm in the back, so I'm going to scoot forward. And we're just going to sit. The hardest part of kind of these exercises is just being, I feel like. Okay, so let's sit at the edge of the chair, nice and tall, hands on your thighs, and I invite you to close your eyes. And we're just going to breathe. And I want you to focus just on the breathing for a moment. Just trying to focus on the way it feels what the air feels as you breathe in, how it feels on the way out. You notice your mind is drifting, totally normal. Just acknowledge it and return back to the breathing. Let's take our attention away from the breath. Maybe just the sensations of your feet on the floor. And then feeling your hips on the seat, feeling your hands on your thighs, feeling the weight of your head. Feeling what it feels like to be still. And then let's release any of the thoughts. Let your mind do whatever it wants. Think if you want, just for a moment. And then we'll open our eyes. And yeah, let's kind of settle a moment while we transition to a little bit more of an open forum, I guess. Experiences, whatever you want to talk about. If there's any questions, we definitely willing to. We have plenty of time to talk about. So let me share one more thing. All right, here is contact info for Oliwia and myself. You can get ours probably the easiest by email. And these are the locations and numbers of all our on-site locations. Midtown, Upper East Side, with new clinic in Park Slope in Brooklyn. You can live information on our website. Our weekly balance class, again, is every Friday at 1:30. And it's on Zoom, it's free. I put a link in the chat already, I'll put another one. But yeah, well, I'll leave this up for a little bit while maybe we answer some questions.
Great job, guys. Thank you so much. That was excellent. So before we unmute everybody, I'll just ask some questions through the chat, and then we can go from there. There was one that actually came in before the presentation that I wanted to get your feedback on. Somebody asked about any support groups that you knew about for PPPD or BPV. The people that are going through this, they may need some more guidance and some help and support. So do you know of any support groups for those types of conditions?
Yes. So not at the top of my head. We actually went over some support groups in our previous webinar as well. So that's definitely something that we can post. I think Justin, VEDA, right? VEDA.
Yeah. It's the Vestibular Disorders Association. They have support groups that mostly, I think a lot of them now are still online. It was all in person before, and then during the pandemic it went online. I think a lot of them are still online. But I'm
gonna add a link here.
Perfect.
Okay, super. Thanks, guys.
In the chat.
Okay, awesome. All right, so while you do that, I'll just read out some of the questions that went to everybody. In terms of shoes, Olivia, you were talking about what types of shoes are good for the winter. Do you have any types in mind, or brands, or just things that people should look for?
So I recommend something with what's called a lug sole. That's just something a little heavier and chunkier. Something that's going to be snug on your foot is really important. A lot of the time with winter boots, they don't have like shoelaces or maybe just a zipper, and your foot might be flopping around in there a little bit. So just making sure that you have a thick sock and a snug fit, and just something with a little bit of grip. Usually if you go into, I think I saw someone say they got a pair at REI. Yeah, that's a great place to get them. Any sports store or like smaller shoe store, if you just ask them for some a winter boot with good grip, they'll probably give you a better recommendation.
Mm-hmm. Great. You briefly mentioned about the good ways to fall, if that's possible for some of our patients. So can you describe that a little bit more in depth? You know, there's a question about falling with your hands by your ears. I'm not so sure that they understood what you meant. So can you just go into a little bit more detail about that?
Sure. So like I said, the main thing you want to do is just stay kind of loose. So keeping things bent is better than keeping them extended and rigid. So bringing your arms up by your ears, this is assuming that you're going to fall to your side, which that's what is recommended, is to fall almost at an angle slightly towards the side. With your hands being up over your ears, you're able to shield your face and your head to protect your head better, which you know, is top priority probably of what you want to protect when you're potentially falling down.
It makes sense.
I find training for this to be extremely difficult, right? Because things happen so quick that it's one of the most difficult things to predict and to train for, but it's possible, right? So
right.
anything is with repetition, right? Our brains are good at learning things and maybe not having to think about it after a while, but this is the challenging one, I must say. So if you feel like, wow, this doesn't seem like something that I could do, you're not alone, but it is possible.
And that's something that you should practice with your physical therapist as well. If you're seeing someone, or if you're thinking about seeing someone, this is definitely something to bring up, because in, you know, a cushioned and safe environment with the support of a therapist, you can practice this. And you know, it'll, even though it still might be hard to remember in the moment, you're more likely to kind of at least remember what to do. For whoever asked that question, if that's still confusing, feel free to, you know, unmute and ask another question. I hope that makes sense.
Yeah, it does. And a lot of people, once they've fallen, have trouble getting up. So that's something we can also work on in physical therapy, is how to get up from the ground, because I know that's not always so easy. So thank you. Next question. There was something about why women were more likely to fall than men. Is there a reason for that? Do you know?
So the only thing I found about that is variations in gait can have to do with this. So I'm not sure why there are differences leading to falls in the way that women walk compared to the way that men walk as we get older. But that was the only predictive factor I saw for why women fall more recently. But that statistic isn't as important as why women are more likely to break a hip when they do fall, which that has more to do with changes in hormones and how it affects your bones. So women are more likely to experience weakening of bones and osteoarthritis that makes your bones more susceptible to a fracture. So women are slightly more likely to fall, but they are highly more likely to break a hip when they do fall.
There's also research out there that shows that men are significantly less likely to report falls, right? So they're not talking to their healthcare providers as often as women are. So that also might skew the data.
Mm-hmm.
Because we're very proud, us men.
So I'm going to ask you to unmute yourselves if you have any questions, and if you
some other ones here on the side in the chat.
Okay.
Someone said, why should we fall on our side? So that's a tricky question because it's dangerous because you could potentially fall on your hip, but it's better because one, you're able to shield your head. If you fall to your side, you're less likely to fall on the front or back of your head. And you're more likely to land on muscle rather than bone if you fall to your side rather than falling forward or backward. Justin, do you have anything to add to that?
I agree. You know,
Yeah.
it's another thing. It's hard to hard to control sometimes, but with practice, it's doable.
How often should 1 second? I see some hands being raised. Just real quick, how often should someone do these exercises that you guys demonstrated today? I mean, is there like a certain number of days or reps or minutes? Like, what do you think?
So that research article described before shows that 300 or more minutes of exercises, hopefully multi-component exercises per week, are recommended to significantly reduce your risk for fall. So I would say at the top, 20 to 30 minutes a day, really. That's recommended. And it doesn't have to be all at once. Right, you can break it up, but generally it's enough to make changes, not only in the muscles and the joints and everything, but also for your brain. Your brain is really what we're aiming to make changes with.
Super. Okay, I see Margaret, you're raising your hand. You want to ask a question?
Yeah, well, I put it in the chat. I have had several trips and falls, like 25, since 2006. And one of them, the trip happened so quickly that you don't even know what's happening. And I fractured one kneecap, and then a couple of years later, I fractured the other kneecap. And then another year I fell. I just tripped and fell, and I fractured my elbow. And another time I tripped and fell and fractured my wrist. So it happens so fast. It's like a little, I don't pick up my feet enough. But it's on the sidewalks are awful. And forget about the bad weather. I didn't even go into that. That's in good weather. So it happens so quickly. I can't imagine deciding to fall on your side on your muscle when it's happening within seconds.
Yeah. And it's not everyone is going to be able to do that, especially if you're having falls that happen so quickly. And probably the best mode of attack for you would be to try to not have the falls in the first place, like working on activities that promote kind of reducing your risk for falls, like exercises. And okay, we'll try to get there's an old presentation we had all about fall risk and what the actual things that you can do, not only exercise, but there are other things that you can do to help reduce the risk.
If I fell in the grass, that would be different, but this is the concrete in Manhattan.
Yes.
And it happens within a second. And I've had all the falls on the sidewalk. It happens. I use a walker now, a rolling walker, because I have osteoporosis also. I just got diagnosed with that. So that's what I do, is I use my walker, and I use a cane when I'm indoors. So I'm just trying to avoid breaking anything. And it's hard to do within split seconds to do the right thing.
So that's why you wanna take steps to prevent falls in the first place, right? So some of the exercise ideas we mentioned, and seeing your doctor or your physical therapist, all those things can prevent that hopefully from happening again. It's the best thing that you can do for yourself.
Okay. I think Jack has his hand raised. Jack, do you have a question?
Yes, please. First of all, thank you very much. This was great. I tuned in a little bit late. Are you going to send a recording of this session to each of us?
Yes. If you signed up for the webinar, you will receive a link with the recording for sure.
Thank you very much.
Mhm.
And then I think
Adele?
Adele.
I noticed with some of the exercises where you were balancing first on one foot and then on the other, is it normal to feel one leg stronger than the other?
Yes.
Definitely. We all have different things going on. You know, some strength differences. Sometimes maybe you have arthritis on one knee, and it's normal to have a dominant leg as opposed to another side. So totally normal.
Okay, thank you.
And if it's significant, you know, it's something that might be that could be worked on in physical therapy.
No, I just noticed it.
Yeah.
Thank you.
Miriam, do you have a question?
Yeah, if we try to fall on our side, if we can control it, wouldn't we be more likely to fall on our hip and be vulnerable to breaking a hip?
Yes and no. So you're more likely to break your knee or your wrist if you fall forward than you are to break your hip. Your hip is much stronger than your knee joint or your hand, and you have much more cushioning around your hip with your thigh muscles and tush muscles, as well as if you're wearing a coat. So ultimately, no matter which direction you fall in, you know, you're at risk for getting hurt. But from what you know, the recommendations are across all different types of research, that's just the least dangerous way to try to fall. You're more likely to cushion it.
I've heard that. I did fall on my hip. I was terrified that I had a hairline fracture. I knew I was walking, so it wasn't terrible. But I did probably have, I guess, a bone bruise, and it took me about 3 months to actually recover. And I was getting PT at the time, and I just had to stop everything for a while. So I became very concerned about that. For somebody with osteoporosis, a hip fracture, of course, could be quite serious.
Yeah.
And I think a lot of
It's
people
good that
here.
you're able to get with a bruise.
A lot of what we do in physical therapy, as many of you know, involves gait and balance training, as well as strengthening for osteoporosis and flexibility and mobility training. So it's a lot of what we do at all of our clinics, and everyone here. If you feel as if you're at a fall risk, or you're not sure if you're at a fall risk, come on in and we'll check you out, and we'll give you some exercises to help you. I think we're just about out of time here, unless anyone has any more questions.
Howard,
Okay.
you just have to unmute your, okay.
Yes, I did. Okay, doing the sit to stand, is there a trade-off between repetitions and wear and tear on my knees? I don't know how much is too much repetition that would hurt my joint.
Yes, I believe it can be challenging depending on what's going on with your knees to repetitively perform sitting to stands, especially from a low chair. But you know, if those are the times where it would be helpful to maybe elevate the surface to be a little less, much work on the knee joint. Less reps is fine if you can do it. If you need to do less reps, more sets, right? With rest. Yeah, everyone. Not all these exercises are unfortunately going to be helpful for everyone. Do you have something to add, Olivia?
I was just going to say that the number one thing with exercise is just listen to your body. So if something doesn't feel right, you know, maybe take a moment to feel through it and try to modify your position, whether it means separating your feet a little bit or raising the surface. You know, again, if it doesn't feel right, try to just modify it a little bit. Or you know, you could always ask a question as well and have someone take a look at what you're doing differently.
Yeah, thank you.
Sure.
Well, thank you so much, Justin and Olivia. We loved your exercises and your suggestions and your demonstrations and all the information. So really appreciate it. Looking forward to the next one. And thank you again so much. And thank you everyone for tuning in. If you have any other questions, you can just shoot me an email and I'll get back to you.
Thank you.
Thanks, everyone.
Thank you.
Thank you.
You.
Bye, everyone. Stay safe.
Thank you. Thank you for a great presentation. Really good.
Our
Appreciate it.
pleasure.
Thank you.
Thank you. Appreciate it.